Good afternoon, and thank you once again to all of you for taking part in this media conference. I want to start with an update on some of the key statistics in relation to COVID-19 in Scotland. As at 9 o'clock this morning, there have been 10,324 positive cases confirmed, an increase of 273 from yesterday's figures. As always, let me be clear that these numbers will be an underestimate. A total of 1,735 patients are in hospital with COVID-19. This is a decrease of 13 from yesterday. And a total of 133 people were last night in intensive care with confirmed or suspected cases of COVID-19. This is a decrease of 7 since yesterday. And it is with sadness that I report that 18 further deaths have been registered of people who had tested positive for COVID-19. That takes the total number of deaths in Scotland under that measure to 1,249. As I've said previously at these Sunday briefings, these figures should be treated with some caution. Although deaths can be registered at weekends, registration numbers are usually relatively low, and this should be taken into account when looking at today's figures. And of course, the number of deaths that is reported every day is so much more than a statistic. Each death represents an individual whose loss will be a source of grief and sorrow to many. And I want to extend my deepest condolences to all of those who have lost loved ones. As Health Secretary, I also want to thank once again those who are working in our health and care sector for the incredible work that you are doing. Those thanks are due to everyone, the doctors and the nurses, the paramedics, the care home staff, the porters, the cooks, the healthcare assistants, the cleaners, and many, many more. Your work is crucial to the health and the well-being of our country. You will have the same worries and anxieties as the rest of us, but you go to work each day putting that aside to care for others. And all of us are truly grateful for everything that you're doing. I have two issues I want to update you on today. The first is about people volunteering to join or rejoin the NHS and care workforce. It's now almost 4 weeks since, as part of our Scotland Cares campaign, we established a web portal for students and former NHS and care workers to apply to work in the NHS or the care sector as they respond to the COVID-19 outbreak. In total, more than 22,000 people have now volunteered. The volunteers include experienced former staff, doctors, nurses, social care professionals, and nursing, medicine, midwifery, and allied health professional students who are either now graduated or coming towards the completion of their training. We're working with NHS Education for Scotland, our health boards, and the Scottish Social Services Council to ensure that volunteers can start work as quickly as possible while still following the correct induction and training processes. A number of volunteers have been placed with NHS boards, and more than 3,000 are completing their pre-employment checks, which are being fast-tracked just prior to being deployed. The Scottish Social Services Council has placed almost 150 people into work in the care sector, and a further 200 are ready and available for deployment. Not everyone who has applied for help to help us will be needed immediately, but please bear with us. Your volunteering and your offer to bring your skills and your talents really does matter, and we will need you as we go through this pandemic. Having such a large number of volunteers really matters. It provides us with important flexibility as we look at the staffing needs through the different stages of this pandemic. And I'm extremely grateful to everyone who has offered to support our NHS and care services in this way. The second point I want to update you on is support for those who are shielding. That term, as you know, refers to approximately 160,000 people in Scotland who are at the highest clinical risk from COVID-19 and who are therefore being asked to isolate themselves completely. A text message service has been in place for almost a month now, so that people who are shielding can ask for support and receive information. So far, more than 78,000 people have registered for the text service. I would encourage everyone who is shielding to register, even if you don't need additional help at the moment, as many people don't. Registering will be useful if you ever do need that further help. You should have received information on how to do that. Letters were sent to people who are shielding, starting to go out on the 26th of March. But I will also read out the number of our national helpline in a minute or so. One of the services which you can request by text is free delivery of food packages. More than 80,000 food packages have been delivered so far. In addition, 6 supermarkets are offering priority deliveries for people who are shielding. Over 33,000 people have expressed an interest in these priority slots, and we have passed their information on to the participating supermarkets. Supermarkets have also identified and contacted existing customers who are eligible for priority slots, and many have already received deliveries. And people who were not existing customers of any of the participating supermarkets received texts last week with details of how to register. If you don't have a mobile phone, you can get access to these services through your local authority, and our national helpline will direct you to the local authority that applies to you. It is a good way of finding information more generally about the support which is available. The national helpline number is 0800 111 4000. That's 0800 111 4000. And the line is open between 9 a.m. and 5 p.m. every weekday. I know for many of the people who are shielding, this is a worrying time and also a very difficult time. Staying at home all the time is necessary for your own protection, but I know that it is even harder than the restrictions which are in place for everyone else. So we are determined to ensure that support is available to you throughout this period. So please make use of the support if you need to. Before I hand over to Fiona McQueen, our Chief Nursing Officer, and to Jason Leach, the National Clinical Director, I want to emphasise once again the importance of sticking to our public health guidance. Stay at home unless it is for the essential purposes such as exercising once a day or buying food or medicine. When you do go out, stay 2 metres away from other people and don't meet up with people in other households. And wash your hands thoroughly and regularly. These restrictions are tough, and I know they get tougher as the weeks go by, and especially when the weather stays warm. But they continue to be essential. They are the way in which all of us can slow the spread of the virus, protect our NHS, and save lives. So thank you once again to everyone who is doing the right thing and staying at home. You are making a difference, and you are saving lives, and I thank you very much indeed. Now let me turn to Professor McQueen, who wants to say a few words.
Thank you, Cabinet Secretary. And all across the country, our nurses, our midwives, our allied health professions are making an enormous effort, which is meaning that lives are being saved, people are being cared for. We have nurses right across the country who are some of our returners. We've had our student nurses having a lot of discomfort with their educational programmes being changed. And we also have our core staff who work tirelessly across the country 24 hours a day, 7 days a week, to make sure that our NHS is sustainable and that it continues. And I'm incredibly grateful to all of you for doing this. And we also know that the people of Scotland are also indebted to you. The First Minister and the Cabinet Secretary have made it very clear that it's incredibly important that we enhance services for older people who are in care homes. Our care home settings have about 3 times the number of places that our NHS beds have, and principally they're occupied by older people who have multiple physical health issues. and therefore are one of our most vulnerable, requiring a lot of care. You'll have seen from the media that the virus spreads quite rapidly within our care home setting, and it's how important it is that we make sure that our older people have the appropriate support, appropriate care. And First Minister and the Cabinet Secretary have made it very clear that they're expecting us to swivel round and put measures in place to support care home delivery. Now, notwithstanding that our care homes are principally run by private providers, we know that the owners and the managers of the care homes are working tirelessly to ensure the safety of our residents. But what I think is important to note is, just as within our hospitals, when there is an outbreak or to prevent an outbreak, what is incredibly important is additional staff, additional cleaning. And today I'm appealing directly to those nurses who are perhaps returners or are working within our health system in an area perhaps where activity has been scaled back. What is required of us now is to make sure that we rally round, that we support what's happening within our communities. We know that our community nurses are supporting those who are in the shielded category, giving them their health care at home rather than them having to leave the home. We know our community nurses are also supporting what's happening within our care homes right across the country. And what I have done is urge the nurse directors and boards to make sure that the deployment of staff is principally where it is needed to be, and at the moment we're expecting that deployment to wrap around and support our care homes. The safety and well-being of our older people it has never been more important, and I'm appealing directly to staff to work to enhance this and wrap around the care that we want to give our older people, and recognise that their deployment, whilst we've swivelled around our intensive care units, we are now looking at how we look more sustainably across our communities, and that of course includes our care homes, where nurses and social care workers are working tirelessly to provide that excellent care that the families of those who are in our care homes so much deserve, but also rely on, and are incredibly grateful for our health and social care workers in our care home setting.
Thank you, Fiona. And now Professor Leach.
Thank you, Cabinet Secretary. I have two very brief messages to say in this short time. I want to take some moments to say thanks to a group of unsung heroes who rarely get public appreciation, without whom the response to this crisis would not be successful, and who in normal times, at least, are often seen as part of the problem, not part of the solutions, particularly perhaps by clinicians such as me, unfairly, of course. These are people who don't wear scrubs, who don't wear uniforms. They are the managers that lead and plan, make decisions, prioritise the welfare of not only those we serve, but also the frontline staff who care and provide for all of us. There are managers all over our system. They lead care homes, they keep track of performance, they manage our resources, health service managers, human resources managers, finance managers, procurement managers. There are many, many, many more. You cannot treble Scotland's intensive care capacity without managers. You cannot reduce Scotland's delayed discharges by over 1,000 without managers. You cannot build and kit out the Louisa Jordan without managers. You cannot protect the National Health Service and Scotland's population without managers. And while they may not be obvious, I can tell you these people are working day and night to do everything they can to help support their teams, their organisations and the public through this time of crisis. And I want to acknowledge and say thank you to each and every one of them. My second message is familiar. It builds on what the Cabinet Secretary has already said. When you go to a school of public health, the first lesson you get on day one is that individual behaviour affects population health. This is a different time. This is not taking your own medicine to protect yourself. This is about your behaviour having an effect on the whole population. What you do matters for me, for your neighbours, and for the wider Scottish population. Please don't look for ways to push the boundaries of the guidelines. Don't ask questions about what you might be able to do. Instead, find ways to fit inside the boundaries of the regulations. Find ways to stay at home, to celebrate birthdays in a new way, to think about how you can keep in touch with your family in new ways. The more you do that, the sooner we will be able to advise the decision makers that the boundaries should fall and we should get back to a new normal. I know only one thing for sure. If the numbers do not fall, the advice will stay the same. The advice will be to stay exactly as we are. And that is your job and my job to help us. Thank you very much, Cabinet Secretary.
Thank you. Now let's turn to the journalists who've joined us, and first is Suzanne Allen from the BBC. Suzanne.
Thank you. Does the government accept, like some experts have said, that it was too quick to abandon mass testing and contact tracing and too slow to increase testing now? Other countries like Germany and South Korea used the test, trace, isolate effectively from early on. Also, does she have information on timescales? When will these contact tracers be recruited, and when will we see contact tracing happening? Thank you.
So I think we have been very clear all along that we have acted on the best expert scientific and clinical advice available to us and taken the decisions we thought were the right decisions at various points along this road, and that is what we will continue to do. So in the early days in that four-nation plan that was published, we were clear that we were at that point in the phase of containment, and test and trace was a significant part of that phase. But as the virus became more prevalent in the community, it made the right sense at that point, based on that advice and our own judgment, to move into delay, at which point the purpose of testing changed to the purpose that we are currently using it for. But we are planning not only to continue to significantly scale up our testing capacity, but to build the infrastructure, and that work is underway, building the infrastructure that will see us do much more in the way of test, trace and isolate as part of the measures that might be taken, the decisions that might be taken to ease any of the restrictions that we're all currently operating under. That includes looking at what we need to do in terms of the tracing capacity, thinking through what might need to happen to help those who will find it more difficult to isolate because of their personal circumstances, as well as scaling up that testing capacity that we have. We set a target when we started. It was 350 tests a day done in 2 labs in the whole of Scotland, where our target is to get to a capacity of 3,500 by the end of this month, with lab capacity and testing for being able to take the samples across all of our health boards. And I am very confident that we will meet that ambition. But then we will need to go further, because we recognise that we need to have increasing testing capacity. That's also why we are part of the UK-wide four-nation approach, which is those drive-through centres that people have seen perhaps on television and have heard about. So we work with the best scientific and clinical advice that we have and apply the judgments that we can to that. And that's what we will continue to do, bearing in mind how young this virus is globally, how much we learn because of the work of scientists and researchers around the world who are looking at this every day and learning every day about the virus itself, how it operates, how it transmits, and all of that then impacts on the advice and the guidance that we use. I don't know if Jason wants to say any more about that.
I think I would only emphasise the first point you made. Testing is part of a whole response to the virus inside a population. You use testing at an appropriate time for appropriate things. We are now in a suppression phase. We've got everybody to stay at home as much as possible. We are testing key workers and their families. We're testing those who are sick. And when we come out of this curve, gradually and slowly, we will go back to test, track and isolate. Remember, that is not as simple as it sounds. That will be finding people and telling them to stay at home, perhaps on more than one occasion, because they have come into contact with people who have tested positive. None of this is going to be easy. The logistics is one thing. The ability for the population to do that will need a lot of work, and we will communicate that to them.
Thank you. Now, Louise Scott from Scottish Television.
Good afternoon. Care home deaths in Scotland are almost equal to those in hospitals now. There's the new military mobile testing units coming into force this week. As far as I'm aware, that's for testing residents. But testing for care home workers needs to be a key priority. How has uptake been for this? Has it increased since the figures saying it was 20%? Of course, also there is some who may not be showing symptoms but are asymptomatic carriers. How do we prevent spread within care homes from those such workers?
So the figures that the National Registers of Scotland publish, they publish these every week. The latest figures they published on Wednesday that's just gone showed that a third of all COVID or suspected COVID deaths were in care homes, a third. Our most recent figure tells us that of all the key workers being tested, again, the most recent figures show us that 21% have been social care workers. We've put out additional guidance. We've asked our health and social care partnerships to make sure that care home providers understand how their staff can be tested and come forward where they want that to happen. And of course, we also have increased the testing for admissions to care homes so that all new admissions are tested, and that those individuals coming from hospital who've been in hospital because of COVID-19 have given 2 negative tests before they're discharged to the care home. All of that is part of a significant piece of work. Fiona McQueen earlier, our CNO, talked a little about that, about the additional clinical input that we are providing to the care home sector, whether that is the private sector or that part of the sector that is run by local authorities, to ensure that the staff working in care homes who are doing an incredible job have the confidence in the training that they've been receiving, that is increased if they wish it, that they understand all the measures that they need to take, and importantly, that our care homes are following the guidance that was issued on the 13th of March to end communal activities of any description. That means no communal socialising, no communal dining. It's harsh, that was harsh guidance, but absolutely critical to prevent the spread of COVID-19 in care homes. So we are doing everything that we can, monitoring it very, very closely, and are ready to do more if more is required. I don't know if either Jason or Fiona want to say any more. Fiona?
So I think, as the Cabinet Secretary has already talked about when she was talking about testing, we are learning more and more about this virus, and we are gaining much better intelligence about recognising when an older person is COVID positive. Very early on, we assumed cough and temperature, but we now know that with certainty that older people often don't have that, and they display symptoms in a different way. Our care homes are absolutely responding to this and working tirelessly to make sure our older people are well served. Infection prevention and control measures are key and fundamental to this. The Cabinet Secretary has already talked about social distancing within care homes, and that's why we know that additional staff are going to be necessary so that they can support the care of residents, particularly once there is an infection within the care home, to prevent the spread. And again, the Cabinet Secretary has asked the Directors of Public Health locally to make sure that from an outbreak management point of view, this is looked after well and effectively. We do have a clinical group that's looking at guidance for care homes, and I'm expecting further guidance to be issued on that to make sure that we provide the very best care for our older people in care homes that we can, and at the same time support the social care staff, the nurses and care workers who are working tirelessly to do such an amazing job looking after our older people.
Thank you very much. Emma O'Neill from Press Association.
Good afternoon. The First Minister said earlier today she would be prepared to diverge from the rest of the UK if evidence suggested we were at a different stage in the virus. Is there any evidence to suggest that we are at a different stage from the rest of the UK?
So right at the moment, you'll know that on Thursday of the week that's just gone, we published the broad framework of how we will go about taking decisions as to whether or not any of the current restrictions can be eased. We set out the important factors that we will take into account, the evidence that we will need to see, the fact that in our view currently, I think it is a view held right across the UK, for example, social distancing will be with us for a long time, and that what we are now looking at, what we can do is how can we continue to live with this virus? At the moment, the numbers are encouraging that the current restrictions have been effective in suppressing the number of cases. But we're not there yet and confident enough that that has been achieved. So we need some more weeks of numbers to give us that confidence. Whilst that is happening, whilst the current restrictions are in place, difficult though they are, and how grateful we are to people across Scotland for the compliance with those measures that they are demonstrating. Whilst that is taking place, we are gathering the information, not just here in Scotland, but as part of SAGE, the UK advisory group on emergencies, looking globally at what is happening in other countries, making contacts with colleagues in Europe and elsewhere to try and understand what might be the impact of any easement or partial easement of any of the restrictions. How would that impact on the number of cases and our capacity to keep them at a level where we protect our NHS capacity to deal with people who are sick from COVID-19 and to reduce the number of deaths as far as we can. So all of that work is underway, but we're not yet at a point of being able to set that out in detail or say what kind of decisions we think we might take. A number of options are on the table. First Minister has pointed to some of those, but been very clear that those are not decisions, they're simply examples at this point. Whether or not there is a difference across the UK in how restrictions are eased in any respect, what we are clear on is we will not be different for the sake of being different. It is important as far as we can that all four nations in the UK move together across our handling of this pandemic. That's important because, you know, the virus doesn't recognise boundaries and barriers, but also important because people then can more clearly understand what it is we're asking them to do. But if the evidence suggests to us that the timing might be different for Scotland, might be more appropriate for our population or our geography here in Scotland, or the ways in which measures may differ slightly in how they are eased, then we will present that evidence and our decision and be really clear with people about why, if we are taking slightly different decisions from the rest of the nations of the UK, why that is the case. But what we will not do is be different just for the sake of being different. This is far too important. This isn't about politics or constitutions. This is about saving lives and protecting the population of Scotland as best we can. Next, we have Chris Musson from The Sun.
Hi, Health Secretary. We reported today on an issue with the latest PPE shipment from China that the First Minister had announced on Friday had landed at Prestwick. A labelling mistake led to the shipment being kept at the airport, as you probably know, until it's sorted out. Now, there's no suggestion that this is the Scottish Government's fault, but can you tell us, is this shipment still at Prestwick Airport? And if so, how long is it expected to be there? And can you explain what's being done, what had to be done to sort this out?
So this is a really important shipment for us. It contains 10 million IR masks. So that's the fluid-resistant masks. It also has 20,000 testing kits that are important. And also in the shipment is 1 million of those fluid-resistant masks, which are bound for NHS Wales. So it is important. What we knew was that it was possible that the fact that the shipment didn't have a label on all the boxes but had a note inside the boxes may not be sufficient to clear them out of the airport and get them to where we need them to be. But we took the view that it was better to have that aircraft with that important cargo sitting on a runway in an airport in Scotland than sitting on the runway in China. So we now have it here. It has all that important cargo. The work is underway to resolve the issue around labelling. We expect that to be completed this week. And at that point, the cargo will then be distributed. For NHS Scotland, it is not immediately needed at the front line, but it will add importantly to our stockpile. So it is part of the work. The First Minister talked about it on Friday, about the work that's being led by my colleague Ivan McKee to ensure that we can source maximum amount of the right PPE, not only from China and elsewhere, but also in the work that we're doing with companies here in Scotland to increase the supply chain. For example, she talked about the supply chain that under his leadership had been put in place to produce the volume of hand sanitizer that we also need. So that's where we are with the shipment from China. It's, as far as I know, still there at Prestwick Airport. Whilst we resolve this issue, we will have it resolved within a week, and then the supplies can go to our stockpile here in NHS Scotland and down to our colleagues in Wales. Thanks very much. Paris Gustinanis. Sorry, yeah, Chris.
Said there. Yeah, sorry, just to clarify, based on something you said there, you said it was better to have it here than on an in an airport in China. The suggestion there is that you knew about the labelling issue before it arrived, but we know that there were drivers sent on Friday to pick this stuff up, so that doesn't quite make sense.
So, Chris, it's not a suggestion that we knew there might be a difficulty. I actually said when I started answering your question that we knew that there may be an issue with the labelling, but there was notification of what was in each box inside each box. And we took the decision that that may well be enough. So let's bring the shipment here and keep it, if we need to, before the labelling is sorted here in Scotland at one of Scotland's airports, rather than have a long distance, if you like, resolution to an issue. So we have the shipment here now. The labelling question will be resolved this week, and the stock will go out, as I've said, to NHS Scotland and down to our colleagues in Wales. And in terms of the drivers being there, well, we thought it was better to have them there on the basis that the absence of label but the presence of a proper note inside each of the boxes would be sufficient. And the drivers were there then to take the cargo to where it needed to go. That didn't turn out to be the case, but that was a sensible bit, I think, of forward planning so that we do everything we've said to do, we would do, which is maximise our sourcing of PPE and get it as quickly to where it needs to be as we can possibly manage. Now let's go to Paris Gustinanis. Paris, I hope I've pronounced that correctly.
Thank you, Health Secretary. This week, the SNP MP Stuart Hosey said that the UK government's response to the outbreak had been far too slow, far too late, and far too chaotic in its approach. Given those comments, does the Scottish government support calls for a public inquiry into the UK government's approach? Given, as you said, that the Scottish government has followed rather closely that approach so far, will the inquiry be mirrored by a similar process in Scotland? And given the article that was written by the First Minister today, should that inquiry also look at levels of pay in the care sector and whether that had an impact on the spread of the disease in care homes?
So my understanding of what my colleague Mr Hosey said in his news release is that he was focused on three particular areas, whether or not the UK, or the decision the UK took not to be part of EU procurement, he thought was the wrong decision, as did we. He commented on an amount of money that had been spent by the UK government on tests that was a speculative spend. Due diligence does not appear to have been done, and so I understand why he made that comment, and he made some comments also around the shipment from Turkey. So I can understand the areas where he was commenting and then making that assessment, and certainly in terms of EU procurement, that would be an area that we have said we agree with him on that. We should have been part of the EU procurement effort. There should be no boundaries to where you try and source the PPE that our health and social care staff so much need. On the inquiry question, I think we have been clear on a number of occasions at this briefing that I fully expect there to be a proper, serious look, maybe in an inquiry. If it is, we will, of course, take part in that freely and openly, about how the governments of the UK have responded to this pandemic, the decisions that have been taken, the basis of those decisions, the various factors that have come into play. And of course, if it is an inquiry, then the inquiry itself will look as widely as it chooses to do. And I think that is right and proper. There should be proper scrutiny so that we can learn for the future about the where we may have got things wrong, where we may have acted quicker, where we have got the right approach and done the right things, so that all of that is there for the population of Scotland and the whole of the UK to learn from that and see how we might prepare ourselves for any future pandemics that may hit us. But right now, my focus as the Health Secretary is on everything we need to do in order to ensure that we protect our NHS to cope with the pandemic and the demands that it will make on it, maximise the use of the NHS for the urgent care and our GP practices, and ensure that we minimise the level of life lost as a consequence of COVID-19. Next, we have Severin Carroll.
Thank you. Good afternoon, Health Secretary. Thank you very much. This is a two-part question for you, please. Firstly, is the Scottish Government concerned about the fact that Downing Street Special Advisors Dominic Cumming and Ben Warner are allowed to take part in SAGE meetings? And secondly, does the Scottish Government believe that it's right that the Scottish Government Chief Medical Officer or Chief Scientific Advisor and the Welsh Chief Scientific Advisor are not allowed to participate in the same way that special advisors from Downing Street are allowed to participate?
Thanks, Sev. So my answer to the first question is it is for each individual government to decide how best they deploy their special advisors. And so it is a UK government decision, and it's for them to take that decision. In terms of participation in SAGE, of course, we have a very strong engagement with SAGE, and now that we have our own Scottish advisory group chaired by Professor Andrew Morris, he is a member of SAGE, and the work that the group that he leads undertakes is looking in particular at the work, he's engaged in the work that SAGE has underway, and then looking in particular at how that may apply to Scotland with our particular population and geographic differences. In addition, of course, the chief medical officers of the 4 nations are in constant contact. I know that the chief nursing officers are too, that Professor Leach here is in contact with Public Health England, but also with colleagues in Europe and elsewhere, so that we can maximise the learning and the experience of others across as wide a network as possible, and of course contribute to that ourselves. Next, we have Tom Gordon from the Herald.
Hello, Health Secretary. Last week, when it emerged Boris Johnson had missed 5 meetings of Cobra, your colleague at Westminster, Ian Blackford, accused the UK government of jaw-dropping negligence and complacency. Was it jaw-dropping negligence and complacency when Nicola Sturgeon missed those same meetings?
So I think I said at last Sunday's briefing that from the very first Cobra meeting on COVID-19, I have been present at all of them with one exception, I think. That is normal. Those early Cobra meetings were chaired by Matt Hancock as the Secretary of State for Health. It's parallels a process that was underway when we were dealing with the swine flu pandemic, and the First Minister took part from the 2nd of March. But in addition, and importantly, important for the people of Scotland to know, is that we stood up our Scottish Government resilience operation in late March and in late January, my apologies, in late January, and that was chaired by the First Minister from the very first meeting, with the exception right the way through until recently. There was a recent one on Friday there, all the way through with one exception, and in that instance it was the Deputy First Minister who chaired that particular Scottish Government resilience operation, looking across the whole of government. So in the initial stages, we were looking at this very much from a health perspective, and then of course as the pandemic progressed, the wider implications and the wider decisions were taken about how we should address this and deal with it that affected a much broader spectrum of Scottish society. And we took part in those Cobra meetings appropriately, but importantly had stood up our own Scottish Government resilience operation to ensure that here we were planning from January right the way through about what more we needed to do. There was, of course, health planning before then, but formally that resilience operation was activated towards the end of January. Next, I have Izzy Lyons from the Daily Telegraph.
Hello. Hi. Question for the National Clinical Director, if I can. The First Minister said this morning that she hopes to continue having conversations with the UK government about the power she has to close the Scottish border should she see it fit to help prevent the spread of coronavirus. Is this something that you think could help prevent the spread of the virus? And secondly, is it something that you think the UK government should consider?
Just before I go to Professor Leach to answer that, just for clarity, can I be clear that what the First Minister was talking about was about the international borders, i.e. entry into the UK from outside of the UK, and raising and discussing with the UK government what more could be done there, and whether or not that was something that they would seriously consider, because of course entry into all our ports from outside of the UK is a reserved matter for the UK government. Now, let's see, Professor Leach, if you want to add to that.
Only that one of the elements of the WHO's 6-point plan for removing countermeasures, we've talked about one of them already. One of them was test, track and isolate. One of them is to suppress the virus. One of them is control the importation of cases. It sounds a little technical. So my advice and other advisors' advice to the Scottish Government and to the UK Government will be to control the importation of cases. Now, some of that will be in the Scottish Government's hands. Some of that will, of course, be in the UK Government's hands. My advice to the decision makers will be that we have to look at the importation of cases very seriously in that removing of countermeasures. And then it will be up to the decision makers to make those choices.
Thank you. Rachel Watson now from the Daily Mail.
Can I just go back on that point about what the First Minister said on Andrew Marr this morning? She was specifically asked about, when she was asked about borders, she was specifically responding to being asked about England and Scotland taking a different approach. So are you saying that there's no circumstances under which the First Minister would close the border between Scotland and England should she take a different approach?
What I'm saying, and I think I answered earlier about the basis on which we would take a different approach if that was something that we considered. And I was really clear that we wouldn't be taking any kind of different approach in any respect, simply for the sake of being different. But it would be evidence-based if we did do that, and we would set out that evidence very clearly, and it would be part of a discussion that is the four-nation discussion, as it has been, about how this pandemic is handled at all the various stages that we're talking about. The First Minister's concern and interest is around the international importing of cases, as Professor Leach put it, and understanding very well what the WHO advice is, but being clear that controlling entry into our ports, our airports, or our seaports is a reserved matter and therefore has to be something that is discussed and decided upon by the UK government. Now we have Henry Anderson from Health and Care Scotland.
Good afternoon. On the 31st of March, as part of the national effort to combat coronavirus, the Home Office announced that doctors, nurses and paramedics from abroad will automatically have their visas extended free of charge for 1 year. On Thursday, the leaders of 6 organisations representing the care sector and voluntary organisations in Scotland wrote to the Home Secretary asking for the UK government to do the same for care workers from abroad, including volunteers. The letter was signed by the heads of CAMPIL, CCPS, the Health and Social Care Alliance, SCVA, Scottish Care and Volunteers Scotland. Do they have the Scottish Government's support in this call? And what assurances can you give health and care workers from abroad who are working in Scotland that their contribution during this crisis won't be forgotten?
So what I can say unequivocally is that the Scottish Government does support that call. I spoke with Donald McCaskill from Scottish Care about it towards the back end of last week and knew that that was a letter going, a very powerful letter signed by a number of organisations, important organisations, and assured him on the phone that he had our absolute support for that. We will be making that support clear to the UK government. What our social care workers do, wherever they come from, is vitally important, and they are valuable and valued, not only by those to whom they give care with such attention and compassion, but by me and by the Scottish Government. So there is no good reason that I can see why you would take a different stand for our NHS workers as compared to our social care workers. Both groups of staff are vitally important in the work that we're doing on this pandemic, but actually they're vitally important every single day, regardless of whether we have a pandemic or not. And I think our views as a Scottish Government on immigration and immigration controls have been very clear for a number of months now, and we've set them out really clearly, and we continue to want people who are here, who've chosen to make Scotland their home, to know that they are appreciated, they are welcomed, and we want them to stay and continue to do the very valuable work that they are doing. So Henry Anderson was our last journalist to join us, so can I thank all of them very much for taking part in this afternoon. Can I thank all of you who have been watching. Can I repeat, though, before I go, those really important public health messages and the importance of sticking with it. We are making a difference. You are making a difference. But we need to keep going with those important public health messages. We need to keep on staying at home, except for those essential purposes of an hour's exercise or purchasing essential food or collecting important medicines. When we do go out, we need to maintain that 2 meters social distance, and we mustn't have our household mix with another household. You are making a difference every single day. You are helping us to control this pandemic so that we can get to a point where we can take reasoned, phased, managed decisions with your involvement about how we can ease those restrictions and continue to safely live with this virus as far as we possibly can, managing its transmission, making sure we protect our NHS's capacity to cope, and minimising deaths. Thank you so very much from all of us, and thank you for joining us today.